Thank you for that introduction, Achaiba. So as he said, I am Dr. Mitra Maharaj and I'm the co-founder of Healthy Mind Foundation, which is an organization, a non-profit organization that is geared towards raising awareness of health-related issues in the country. So when Jonathan called me and he told me of the plans to do this benefit concert for Levi, it brought joy to us to say, yes, we definitely will come here and bring this sort of awareness. Levi's uncle, Saud, and myself are friends from university days, and I was aware of the case from social media and so forth. Now on my left is Dr. Risha Sukwa, who is a consultant in the anesthetics and ICU department in the San Fernando General Hospital. Dr. Sibaran Singh is a very experienced medical practitioner with years of service at SMGH, and she's also a volunteer at our foundation. She has actually worked alongside Marissa, which is Levi's mom, at San Fernando General. So when I called Risha and I told her about the concert, I told her what Jonathan asked us to do, she was more than happy to jump on. So, Risha, just tell the people who at home, who you are, how you know Marissa.
Well, as Mitra so eloquently said, I am a consultant at the Department of Anesthesia and ICU Intensive Care at San Fernando. And I actually worked with Levi's mom a lot of years ago. This was even before Levi was born. I remember when Levi was born. I have known Marissa. She's one of the most caring, gentle, amazing people that I have ever met. And she's a fighter, as I assume so is Levi. I've seen that for myself. So I'm willing and more than happy to give any assistance I can to the family, and especially to Levi and Marissa.
So I will jump here this afternoon just to bring awareness on the actual disease or diagnosis that Levi is suffering from right now. So, Risha, what is leukemia? What are the types that, how does that affect the body?
So, the simple way of saying it is that leukemia is essentially cancer of the blood cells and bone marrow. Bone marrow being the aspect of your body that actually produces the blood cells. So you can think of it like the blood cell factory. The way it affects the body, there are many effects, mostly especially related to the fact that it affects the production and the function of your blood cells. So some of the symptoms that a patient might come in with, and I mean, they're very far and wide as you would expect. Things like fever, joint pains, the patient might have a high, like symptoms of an infection almost, right? High white cell count, that is one of the markers for infection. The patient might have bleeding, things like little blotches on the skin. So it's a huge myriad of symptoms that you could come in with. A lot of it are very non-specific, as in not directly pointing to cancer. It could be a lot of causes. So it's very difficult initially to diagnose.
So now leukemia is a broad name of multiple different types. What are some of the types and what is the type that Levi is actually suffering from?
So like you said, there's a lot of different subtypes of leukemia. What Levi is suffering from, unfortunately, is called BALL, acute lymphocytic leukemia. That is the most common in kids, and there are also two of the more common ones, I would say, AML, acute myeloblastic leukemia, and CML, chronic myeloblastic leukemia. So like I said, Levi has BALL, which is most common in kids.
Now, I practice occupational medicine, so the last time I hear about these names was way back in medical school when I studied hematology. So could you tell the audience at home, what are the different treatment options that are available in the public and in the private sector in Trinidad?
So with respect to the ALL, we'll speak specifically about, the ALL aspect of the leukemia. You have the typical treatment protocols would involve things like chemotherapy, which is common in most cancers. They would use chemotherapy, and also they can do radiation to the cancer site, the site specific to it. So both chemotherapy and radiation.
Now, what we've heard about his condition is that it relapsed, or he was in remission and then it relapsed. What exactly is that?
So when a patient is in remission, essentially what it means is that the patient underwent treatment And then subsequent to that, when they did testing, and when I say testing, they do both blood and bone marrow, which involves basically, taking a sample out of your hip, right? Most common site. So they do a sample bone out of your bone, and they test it for leukemia cells. So when a patient is actually considered to be under remission is when they no longer find the leukemia cells in that sample that they take. Now, relapse basically means, as you would expect, the cancer came back.
Now, the treatment that Levi has gone to the United States for is a bone marrow transplant. What would have led us up to this point? What is a bone marrow transplant?
Okay, so with respect to ALL, what I would say is that for patients who are newly diagnosed with ALL, about 30 to 40% actually relapse. And this is even with the most optimal treatment. Because of how aggressive ALL is, they relapse, which is what happened to Levi twice. Now, why you need the bone marrow transplant is basically what it's doing is that when his bone marrow isn't functioning as it should, it's producing leukemic cells, bad cells, cancer cells. And with the bone marrow transplant, you're basically going to take out his bad cells in a sense. You're going to stop it by using drugs and radiation and chemotherapy, suppress it, get it down, and then replace it with bone marrow that is actually functional. So that would actually produce proper blood cells for him.
Now the bone marrow that we put in, where do we source that? Is that a donor? Is that we buy that in the grocery? where do we source that?
Well, probably not a bone marrow grocery, but there are lots of different ways you could get bone marrow. One of the ways is what they call a sibling donor. So if you have a sibling, your sibling can give you bone marrow because you actually have to be matched. All right, it's not that you could take bone marrow from any person and put it into someone else. So you can have a sibling donor. Now this used to be very common, but a lot of us don't have siblings or don't have kids with siblings. So if you don't have that, there are a lot of other options. There's a matched donor. Now there's an actual bank with bone marrow, right? There's a bank with bone marrow donors, I should say, not with bone marrow donors. And you could be matched with one of such donors who are not related to you, and you can receive bone marrow from them. Or more commonly now also, you can get bone marrow from your parents. So it's like a 50% match. There's a big fancy name, haplotypic and whatnot, but it's a 50% match. You get bone marrow from one of your parents, and they've actually found that to be as effective as the sibling donor. So that's pretty good. So he has 3 options essentially.
That sounds like a very challenging process to go through to find a donor, especially if it is that the person doesn't have siblings.
Yeah.
So how successful would that bone marrow transplant be?
So if we're looking at success and prognostic factors, now prognostic means basically your chances of survival. Doing a bone marrow transplant realistically is very risky because the actual procedure itself is risky. Not just doing the transplant, you need to basically get rid of the person's immune system, completely get it down, and then you put in new bone marrow. And even after you put in new bone marrow, you still have to kind of keep down the the bone marrow, the body's reaction to the bone marrow, to make it simple. And you also have to prevent that patient from getting any infection. So they actually have to be kept in very specific areas, not just, you can't just have them on a normal hospital ward and whatnot. You have to have them in special rooms, very minimal to no contact with the outside world, because you don't want the patient to get things like infection. So because of how risky it is, this procedure, the mortality, as in the outcome, about 50 to 60% of patients have a successful bone marrow transplant.
So let's hope that Levi is one of those.
Definitely.
So, you spoke about the process after. How long do you think that process should be undergoing? Do we think that we can fly Levi back home right after the transplant?
No, like I mentioned, it is a very intensive care period even after post-transplant. I would say at least 3 months he's going to have to be under very seclusion, isolation. And then even as such, he would still travel and things like that would be extremely risky.
Yeah, and we all went through that seclusion and that isolation during COVID, so we know the impact that will have, the impact that had on all of us.
Yeah.
So now, Levi, his whole family is going through this process. They've been going through this process for a number of years now, and it has obviously been taken a toll on the parents, his uncles, aunts. What message you could give to his family or his friends, his supporters, his well-wishers, just to give them some support in this time?
What I would say is that, we have to, one, they have to stay strong for both the family. All of us have to stay strong for both the family and the immediate, Levi especially, right? And his mom, his dad, his brother. The family support is not just going to be something financial that we're going to have to do. I think the whole community has to support them emotionally, physically also. And it's something that we have to, it's like an ongoing thing. It's not just this one occasion that we're going to come together and support them. I feel like it's going to be something throughout the months, checking in on them, nice messages, just, being around for them. And it's something we could fight through and we can make it through. And as you could see here, Levi and his family have a lot of support. The outpouring has been amazing. I've been keeping track of it myself, and we're all here. I think pretty much the whole country and even foreigners are on board and trying. So I think we have the support. We just have to keep it up.
So thank you very much, Dr. Kevon. Thank you for your time, thank you for your expertise, thank you for coming here and spreading this awareness to those at home, those who are here in the studio with us. Thank you very much, thank you so much for that. I want to express very thanks to Jonathan and Child Music and his friends and all of the artists that are coming here to perform and to spread that awareness of Levi and his condition. And we hope that it obviously goes successful for him. For those of you who are at home, please do spread the awareness. Click on the GoFundMe link and donate as much as you can, and to spread to those who you think can donate as well. Thank you all for listening to us, and I hope that you have learned something from us this afternoon.
Thanks again.
You're up.